Hello. Ram Ram and good evening. This is a post-lunch session, so I think so everybody is awake because we are going to see the patients who may be in delirium because of decrease in the cerebral perfusion, and we have to make them more alert. So we are going to deal with carotid plaque and its anesthesia implications. Basically, the carotid stenosis is because of carotid artery atherosclerosis. It is the most common cause of stroke all over the world. It is second leading cause of death, 1.44 lakhs per year in US and 5.4 million deaths per year worldwide. Around 8 lakh people get stroke in US and 3 lakh have transient ischemic attacks. There is a large spectrum of complications which are associated with carotid stenosis and atherosclerosis, that is ischemia, embolization, thrombus, stroke. We can deal with these patients either medically, surgically or with stents. The first surgical treatment for carotid plaque was done in 1954 by DeBakey, and it was to reduce the risk of stroke. Initially it was thought that all these patients will be best done under local anesthesia because the patient will be awake. Neurological assessment is more easier because patient is going to respond to you if any neurological changes are there, and the hemodynamic stability is also there. Then slowly, as the drugs for general anesthesia improved, the general anesthesia got popularity, and it was said that the patient will be more tolerate the surgery more, the anxiety will be less, and they decrease in the oxygen requirement of brain. And one more thing was thought, that a complication rate will be less if the patient is asleep. Later on it was seen that most of these neurological events which occur are embolic. So they are same in regional anesthesia or local anesthesia and in general anesthesia. So in last decade there is resurgence of regional anesthesia in these cases. So still the dilemma is there when you are giving anesthesia to these patients, either local, regional, general anesthesia or combination. Stroke which occurs in asymptomatic patient is around 5% per year, and in a symptomatic patient it can go up to 10% per year. Basically the plaque is at bifurcation of a carotid at the internal carotid artery. Carotid artery, internal carotid artery, there will be 80% of chances of plaque formation, and vertebral artery is 20%. Embolization is more problematic than only occlusion of the carotid. The brain is well protected with collateral circulation. The circle of Willis the circle of Willis will protect the brain if one of the carotid has a atherosclerotic plaque. But if both have, then there is a chances of more ischemic episodes are there. The other collateral circulation is from the external carotid artery. Okay. The other one is from the external carotid artery. They can be collaterals which will protect the brain if the internal carotid artery is blocked or clamped. There are multiple important structures which are near and around carotid. They are like hypoglossal nerve, vagus, recurrent laryngeal, phrenic, mandibular branch of facial nerve, the carotid body which has the baroreceptors, and all these have to be taken care of and to be dealt with when you are dealing with the carotid plaque. These patients will present as either transient ischemic attacks which will last for around 24 hours, or a reversible ischemic neurological event which will last from 1 day to 14 days. If there is a problem in the posterior circulation, these patients will have a drop attacks or transient monoocular blindness. If it is severe, then the patient will go have hemiparesis or hemiplegia. If there is no embolization and there is only occlusion leading to ischemia, the patient will present as dementia, decrease in awareness of the surrounding. We have to differentiate all these lesions with intracranial mass, embolization, atrial fibrillation with thrombus causing embolization, valvular heart disease, encephalopathy, and diabetic ketoacidosis. There are multiple associated problems in these patients like coronary artery disease, hypertension, pulmonary hypertension, cardiomyopathy, severe pulmonary dysfunction like bronchiectasis or bronchitis, because it is very common in patients with who are smoking or chronic smokers, diabetes mellitus, obesity. Peripheral vascular disease is very common because atherosclerosis is there all over the body, and also the renal artery stenosis leading to renal hypertension. When we are evaluating these patients, we have to see for the risk factors. Old age is one of the main risk factors. One of the studies says that around 70 years of age, and other studies says around more than 80 years of age is more risky than the people who are of less age. Then severe heart disease, hypertension, IIHD is a risk factor. Severe pulmonary dysfunction is a risk factor, and other than those are metabolic changes which occur in the body, hypercoagulable state, renal insufficiency, and hyperlipidemia. The goals of giving anesthesia or treatment of these patients is to have protecting the brain and heart from ischemic injury, because these patients are having coronary artery disease and carotid plaque also, so you have to protect both brain and heart. We have to maintain the hemodynamic stability, prevent any anxiety, any sympathetic overload which may cause problems in the postoperative period. We have to ablate the stimulatory response of pain, so we should have a very good pain relief preoperatively, intraoperatively, and postoperatively to have a good hemodynamic parameters. At the end of the surgery, the patient should be awake, cooperative, and with a clear neurological evaluation which can be done. If the patient is not awake or not cooperative and we are not able to do the neurological evaluation, the chances of ischemia or stroke intraoperatively are very high. We have to optimize these patients because these patients have multiple problems. We have to optimize this patient. First is coronary artery disease. It is most common with stroke, and if the patient has recent angina or recent TIA, the risk increases by multiple folds. There is again one more dilemma. What should be tackled first, coronary artery disease or carotid? There are multiple answers for this, but most common one is symptomatic carotid with bilateral stenosis. First is carotid. Asymptomatic carotid with unilateral carotid blockade, either you have to go for a CABG first or go for a combined procedure. If you go for combined procedure where carotid is handled first, the chances of mortality decreases 1:8. So in most of the opinions, we have to tackle with carotid first and then with the heart. Statins, aspirin, antiplatelets, beta blockers, these all decrease the cardiovascular risk intra and postoperative. Hypertension is the second most common, commonly associated with these patients. 55 to 80% of these patients will have hypertension. Again, statins and beta blockers and antihypertensive treatment is important. One thing has to be remembered. If the patient is coming with hypertension and tomorrow he has to be operated, the blood pressure is around 180 by 110. You control it with antihypertensive for 1 day and then take the patient, the chances of complications are very high. So gradual control of blood pressure will restore the blood volume, reset the cerebral autoregulation to normal, and will have a better perioperative outcome. As we have seen that coronary artery disease and carotid plaque, 30 to 50% of these patients undergoing CEA have coronary artery disease. AHA-ACC task force and the cardiac risk certification says that CEA is an intermediate risk procedure for perioperative cardiac mortality or morbidity. It is less than 5%. The other things to optimize this patient is to control the systemic diseases like hypertension, diabetes, thyroid dysfunction, renal dysfunction, optimize the hemodynamics, continue with the cardiac medication and continue with aspirin. Check if the patient has recent cardiac or neurological events, and you have to elevate the anxiety because anxiety is bad in these patients, and if the patient is very anxious, then the postoperative outcome is not very good. The basic investigations are done. On that we have to do carotid Doppler to see the position of the plaque, carotid angiography to see the extent of the plaque, digital subtraction angiography, MR or CT angiography to see if there are any other things associated with carotid atherosclerosis. The choice of therapy will be either medical, surgical, that is carotid endarterectomy, or carotid stenting. There is a dilemma if the medical management versus perioperative stroke, death and cardiac event. The patients with minimum of 50 to 70% of stenosis are candidates with ipsilateral disease are acceptable, have acceptable surgical risk. But if there is a greater degree of stenosis, medical therapy is supposed to be better in few of the studies which have shown. Now, what should we go for, either surgery or stenting? In JACC journal in 2015, it was stated that recent symptomatic patients less than 2 weeks, age more than 75, tortuous and heavily calcified aorta, and long lesions and heavily calcified lesions, these patients will fare better with surgical approach, that is carotid endarterectomy. Carotid stenting is better with collateral or carotid occlusion, recurrent stenosis, significant cardiac disease and significant lung disease patients. One of the papers stated that the rate of stroke and death is comparative in both the cases, stenting or surgery. But if you can see 6 months to 120 days, the chances of stroke and death is less in carotid endarterectomy patient than in the stenting patients. So now we are going for stenting. These are the, as we are dealing with this in and out, you know what are the procedure. First you put the filter, then you pass the balloon, you dilate the lesion, put the stent and remove the filter. So I am not going to go into details of this procedure. Dealing with anesthesia for stenting patient, it can be done under local anesthesia if the patient is cooperative, is communicative, and the temperature in the cath lab is maintained so that the patient is comfortable. If the temperature is not maintained for the patient's comfort, it is better to give general anesthesia for these patients. If general anesthesia is to be given, it is with intubation, and light general anesthesia is sufficient because the pain is less. Standard monitoring with ECG, lead V5 and 2 with ST analysis because these patients are with coronary artery disease. Cerebral oximetry and somatosensory evoked potential can be done in these patients. If the patient is awake, then contralateral side you can use a squeaky ball or squeaky doll method where if the awake, we lateral side we use a squeaky ball, squeaky doll where if the awake, we lateral side use a squeaky ball, squeaky doll where if the awake, lateral side use a squeaky ball, squeaky doll where if the awake, lateral side use a squeaky ball, squeaky doll where if the awake, lateral side use a squeaky ball, squeaky doll where if the awake, lateral side one thing use a squeaky ball, it is coming squeaky doll he has to have. If the awake, lateral side one thing use a squeaky ball, it is coming squeaky doll there. If the awake, lateral side use a squeaky ball, squeaky doll there. If the awake, lateral side use a squeaky ball, squeaky doll there. If the awake, lateral side use a squeaky ball, squeaky doll there. If the awake, lateral side use a squeaky ball, squeaky doll there. If the awake, lateral side use a squeaky ball, squeaky doll there. If the awake, lateral side use a squeaky ball, squeaky doll there. If the awake, lateral side use a squeaky ball, squeaky doll there. If the awake, lateral side use a squeaky ball, squeaky doll there. If the awake, Collateral side, use a squeaky ball, squeaky doll, the collateral side, 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 squeaky ball, squeaky doll, the wake, collateral side, use a squeaky ball, squeaky doll, the wake, collateral side, use a squeaky ball, squeaky doll, the wake, collateral side, use a squeaky ball, squeaky doll, the wake, collateral side, use a squeaky ball, squeaky doll, the wake, collateral side, use a squeaky ball, squeaky doll, the wake, collateral side, use a squeaky ball, squeaky doll, the wake, collateral side, use a squeaky ball, squeaky doll, the wake, collateral side, use a squeaky ball, squeaky doll, the wake, collateral side, use a squeaky ball, squeaky doll, the wake, collateral side, he has to use a squeaky ball, squeaky doll. One thing remember, if the patient is coming wake, collateral side, he has to use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, method, if the method wake, method collateral side, method use a squeaky ball, method squeaky doll, method, if the method wake, collateral side, use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, is if the is wake, is collateral side, is use a squeaky ball, is squeaky doll, is the patient. If the patient wake, collateral side, the patient use a squeaky ball, the patient squeaky doll, the patient. If the patient wake, collateral side, use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, if the wake, collateral side, use a squeaky ball, squeaky doll, wake, if the collateral side, squeaky ball, squeaky doll, if the wake, collateral side, squeaky ball, squeaky doll, Deb, wake, wake, collateral side, key ball, Vicky doll, Deb, wake, wake, collateral side, key ball, Vicky doll, Deb, wake, wake, collateral side, key ball, Vicky doll, Deb, wake, wake, collateral side, key ball, Vicky doll, Deb, wake, wake, collateral side, key ball, Vicky doll, Deb, for the patient, wake, for the patient, wake, for the patient, collateral side, for the patient, key ball, for the patient, for the patient, Vicky doll, for the patient, Deb, for the patient, for the patient, wake, for the patient, wake, collateral side, key ball, Vicky doll, Deb, wake, wake, collateral side, key ball, Vicky doll, Deb, wake, wake, collateral side, key ball, Vicky doll, Deb, wake, wake, collateral side, key ball, Vicky doll, Deb, wake, wake, collateral side, key ball, Vicky doll, Deb, wake, wake, collateral side, key ball, Vicky doll, Deb, wake, wake, collateral side, key ball, Vicky doll, Deb, wake, wake, collateral side, key ball, Vicky doll, Deb, wake, wake, collateral side, key ball, Vicky doll, Deb, wake, wake, collateral side, key ball, one thing Vicky doll remembered. It is coming, attention, wake, tomorrow he has to wake, collateral side, key ball, one thing Vicky doll remembered. It is coming, wake, wake, collateral side, key ball, Vicky doll, 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 wake, collateral side was a squeaky ball, Vicky doll, wake, the collateral side was a squeaky ball, Vicky doll, wake, the collateral side was a squeaky ball, Vicky doll, wake, the collateral side was a squeaky ball, Vicky doll, wake, the collateral side was a squeaky ball, Vicky doll, wake, the wake, collateral side, key ball, Vicky doll, wake, 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 wake, Collateral side, key ball, Vicky doll, dab, wake, collateral side, key ball, Vicky doll, dab, wake, collateral side, key ball, Vicky doll, dab, wake, collateral side, key ball, borrow here, Vicky doll, dab, one thing, remember, collateral side is coming, key ball, borrow here, Vicky doll, dab, wake, collateral side, key ball, 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 Vicky doll, dab, wake, for the patient, collateral side, for the patient, key ball, for the patient, Vicky doll, for the patient, wake, collateral side, for the patient, key ball, Vicky doll, dab, wake, collateral side, 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 key ball.